We've now administered more than 106,000 doses of vaccine in our province. More than 16,200 Albertans have now been fully immunized with 2 doses. Over the last 24 hours, we have identified 355 new cases of COVID-19 and completed about 7,300 tests. Our positivity rate currently stands at about 4.9%. Looking to schools, there are currently active alerts or outbreaks in 298 schools, or about 12% of the schools in the province. These schools have a combined total of 701 cases. Currently, in-school transmission has been detected in 66 schools, and of these, only 51 have seen only one new case occur as a result. Encouragingly, the average daily number of new cases in the school-aged population continues to fall week over week. Looking at last week, on average, 71 new cases were identified each day among school-aged Albertans. This is down from the 131 daily cases that we saw on average the week before school started in person. So far, returning to school in person has not caused increased spread in this age group. And as I said, in fact, cases continue to fall. We also continued to see hospitalizations decline over the weekend. Currently, there are 556 people in hospital, including 102 admitted to the ICU. The steady decline we're seeing is encouraging and a testament to the ongoing hard work of so many. Sadly, I must announce that 10 new deaths were reported to Alberta Health in the last 24 hours. My sympathies go out to all who have lost loved ones recently, whether to COVID-19 or any other cause. While our cases and hospitalizations are trending down, we still have work to do. We have reached a place where we should be able to further ease measures on February 8th, but we have seen cases fall and rise before. We all must remain vigilant and be extra careful to help keep schools, continuing care facilities, and all other settings safe, and to keep our hospitalizations trending downwards. We all must keep doing our part to protect ourselves, our loved ones, and our community at large. The reason for the declining number of tests, we have been looking at our data and talking to our frontline teams and colleagues to understand what trends we're seeing, and I think there are a couple of different factors. One of them could be that as we have less people who are symptomatic, we have seen, for example, a dramatic decline in all kinds of respiratory viruses, not just influenza, seasonal influenza, but many other kinds of respiratory viruses that normally circulate at this time of year. We've seen a dramatic drop, so it could be that there are fewer people who are symptomatic and therefore fewer going for testing. It also could be that there are some people who maybe are just staying at home and even if they are feeling a bit ill, they don't want to go out and get a test. We are encouraging anyone, if they do feel ill, if they are a close contact, if they are part of an outbreak, to go for testing, as that is the most helpful way for us to track the overall trends. However, independent of the testing behaviors that people go or don't go, the positivity rate is independent in some ways. So that is the proportion of people who go for testing that come back positive. And so whether we have, again, as we had today, under 10,000 or over 10,000 tests, that positivity rate is a reflection of how much disease is circulating within that group that's getting tested. So it is encouraging that it has been declining, although, as you say, over the last week or so, we've seen it plateau a bit. We hope to see it continue to go down. And the last thing that I would say is that of course, as we're looking at these numbers, the hospitalization numbers are independent of people who may choose or not choose to go for testing, because the hospitalization numbers reflect those who have COVID-19 and need care because of that infection. And so we are seeing those numbers over the province slowly go down. In some zones, interestingly, we are seeing a slight increase in hospitalization numbers even as case numbers go down. And so, again, it's really important that we're watching that metric as well, because that is independent of whether or not people may choose to get a test if they have mild illness. And it does tell us that overall across the province, our trends continue to go down in those who need acute care. I want to be clear that no matter whether it's law enforcement or Alberta Health Services executive officers, it's critical that the enforcement of laws in the province is done in an independent way by those bodies who have the authority under legal frameworks to create orders or penalties. And so it would not be appropriate for me to dictate what kinds of penalties would need to be in place in an individual case. I have spoken with chiefs of police and Alberta Health Services to be clear that a gradually escalating process is what we have set out the orders to be able to do, which is that if the education and support fail, then the framework absolutely includes penalties escalating to fines, but it's not appropriate for me to direct in an individual case what exactly should happen. That is at the discretion of local law enforcement and local Alberta Health Services officials who have the legal authority to make those decisions independently. And those who are putting their communities at risk need to be reminded that this is not optional, this is mandatory.